Today, I want to talk about a very uncomfortable topic, which is failed back surgery syndrome. As a surgeon, whenever you do a surgery for a patient, you desperately want your patient to get better because that is what we do and that is our objective, that is our profession. But it has happened to pretty much every surgeon out there, very experienced surgeons, that sometimes you operate on a patient and they don't get better, or sometimes rarely they get worse. This situation is called failed back surgery syndrome, and surgeons really don't feel very comfortable talking about it, but I know that there are a lot of patients out there who unfortunately are dealing with failed back surgery syndrome. Today, what I want to do is talk about four separate categories of patients who have failed back surgery syndrome. And I want to talk about it systematically so we can try to understand why this happens and what can be done about it. So without further ado, let's talk about the most common cause, in my opinion, of failed back surgery syndrome. I think the biggest category of patients who have failed back surgery syndrome are those patients who should have never had surgery to begin with. Now, why does this happen? There are many different reasons why patients who should have never had surgery end up having surgery. And I think one of the biggest reasons for that is because doctors and surgeons really want to please their patients. And there are some patients who are so desperate, who've been living with terrible back pain, who've been living with terrible sciatica, nerve pain. You know, you look at your patient who's had pain management, who's tried medications, who's changed their jobs, who can no longer play sports, who's basically done pretty much everything to control their problem. And despite trying all the non-surgical treatments, the patient unfortunately did not get better. So when that patient comes to you, you really want to do something for this patient. And most of the time you can't help that patient. But in a small percentage of patients, you have to understand that it's in the patient's best interest to not have surgery. So these are the patients who have a surgery when in fact they should not have a surgery. Let me give you an example. The most common example of a patient who should not have surgery are those patients who have purely back pain because of arthritis with very little nerve pain. So degeneration of the discs in the lower back, and in fact in all of the spine, is a very common condition. It's called degenerative disc disease. And degenerative disc disease is a common and natural process that happens with age. Now, it is unclear whether degenerated discs cause back pain. There's a lot of debate among doctors, among pain management doctors, among surgeons, interventionalists. And studies have shown that patients who end up having spine surgery, for example, a spinal fusion for degenerative disc disease and back pain, they don't consistently get better. So these patients 2, 3, 6, 12 months later after surgery are really no better, and actually sometimes they're worse. Now, why did the surgeon operate? Well, one of the biggest reasons is that as a surgeon, you want to do something for your patient. You want to get them better. But unfortunately, a second reason, which surgeons rarely talk about, is financial gain. Now, most surgeons that I know personally, they're very meticulous. They really care about their ethics of their profession, and they really will not operate on patients unless they absolutely need surgery. But of course, as with any profession, there are some surgeons who unfortunately will end up doing surgeries for purely financial gain. That's very sad, but that's the reality of the world, and that's the reality of any profession. And patients who end up having spine surgery in these situations, once the period of healing ends, for example, 6 months or 12 months later, sometimes they're not better, or actually they could be even worse than what they started off with. So as a surgeon, my advice to those patients is to be very careful about when to have surgery. Actually, I made a really good video about don't have spine surgery if. I'm going to put a link to this video up above right over here. And in this video, I take my patient through the different situations where they should be very leery of having surgery. So if you as a patient are dealing with a severe back problem, a spine problem, whether it's back pain or sciatica, you really need to be very careful about whether or not to have surgery and how extensive that surgery should be, because ultimately you are taking a chance and you may not get better. Now, I can tell you that the vast majority of patients end up doing very, very well after spine surgery. And the vast, vast majority of surgeons are very ethical, they're very careful, and they will do right by their patients. But unfortunately, a small percentage of surgeons are not as diligent and may not be as ethical. So, as a patient, you really need to take your health into your own hands and make the right decisions for yourself to avoid this very unfortunate scenario. Another very common reason why patients end up with a failed back surgery syndrome is because the surgeon makes the right diagnosis, but unfortunately does not do the right surgery. What do I mean by that? So, the most common example of this is a patient who has severe spinal stenosis. For example, sometimes because of arthritis, for example, between the L4 and L5 vertebrae, you can form a lot of bone spurs, a lot of degenerated tissues, which really squeezes the nerves in the back, and it could cause sciatica. And most of the time, a laminectomy surgery is the correct surgery. Laminectomy surgery is a surgery where you remove the bone called the lamina right over here, and you unpinch the nerves deep in the spine. So this is called a laminectomy surgery. And this surgery is usually very, very successful. However, sometimes for a variety of reasons, the decompression is done incompletely. And the most classic example of this is a decompression through a minimally invasive spine surgery, where the surgeon, instead of making one long incision, will make one or two small incisions on the side of the spine. And minimally invasive spine surgery definitely has its applications, and it's a great technique. Patients do really well with it, but only under certain conditions. If the stenosis or the arthritis, the pinching of the nerves is very severe, you need to go conventional and you need to make a big incision about this big in the lower back and do a complete laminectomy so you can unpinch the nerve from all sides. Because if you do an incomplete decompression, some of the degenerated tissue, the bone spurs, the arthritis will remain, and the patient really will not make a lot of progress after the surgery. So incomplete decompression is a very common cause of a failed back surgery syndrome. Another common example of a failed back surgery is in case of those patients who need a laminectomy, but they also need a fusion on top of it. What do I mean by that? So when you have spinal stenosis, sometimes the joints in the spine, called the facet joints, become very large and arthritic. So sometimes these joints right over here will become very arthritic, and the bone spurs under these joints will start to push against the nerves. So in order to unpinch those nerves, you need to remove a majority of these facet joints, because unless you do that, your decompression is not going to be complete. And as a result, you will be left with bone spurs that you have not removed, so the patient's symptoms will continue. So in order to stabilize the spine, you also need to fuse the spine, meaning you need to put screws and rods in the spine like this. So this is an example of a patient who needs to have a fusion to stabilize the spine, because by removing a lot of those facet joints, you're destabilizing the spine. And if you don't fuse some patients, meaning if you only do the laminectomy but don't do the fusion, what's going to end up happening is that the facet joint is going to become unstable, and later on, these patients are going to develop a condition called spondylolisthesis, or instability of the spine, which may require a second surgery. And a second surgery is going to be more unpredictable. It's going to be a second recovery time, and you want to have as few spine surgeries as possible. So a lot of times when patients come to see me and they ask me what the appropriate surgery for their condition is, I say, you can have a laminectomy because I don't need to remove a lot of the facet joint. But in other cases, I say you need to have a laminectomy with a fusion, because I will, by necessity, need to remove a lot of the facet joint, and therefore I need to fuse it. Now, a lot of patients are very afraid of fusions, and I totally understand, why that is, because, nobody really wants to have screws and rods in their spine. But sometimes that is the best option for you. And this is one of the things that I really try to convey to my patients when I counsel them about the type of surgery that may benefit them, in our preoperative discussion. So sometimes if you have the correct diagnosis, but you don't have the correct surgery, you're going to end up not getting better, or later on, your condition may get worse and you may need a second spine surgery. So that would be an example of a failed back surgery syndrome. This brings us to the third category of patients with failed back surgery syndrome. And these are patients who have complications after surgery. So the most classic example of this is patients who smoke after surgery. Now, one of the worst things you can do if you have a spine problem is smoking cigarettes. And I have a pretty good video about the severe effects of smoking on healing after spine surgery. I'm going to put the link right up over here. And these patients will have multiple problems after surgery, and they may end up needing a second spine surgery. I've also made a video about that. I'm going to put the link in the description and also right up over here. So patients who smoke after surgery, their tissues, their skin, their fascia, their nerves, their muscle, and their bones will just not heal appropriately, and they will continue to have problems after the surgery. And this is unfortunately very, very common. And whenever I have a patient who smokes cigarettes, I do my very best to tell them that you definitely need to stop smoking, because you're better off not having the surgery if you are going to be smoking after the surgery. So smoking and spine surgery just do not go along, and this is one of the biggest reasons for failed back surgery, because these patients will need more procedures after their spinal fusion or their spinal laminectomy or discectomy. Another common reason for failed back surgery syndrome is scar tissue buildup. So when you do a spine surgery like a laminectomy or discectomy or decompression, you're removing abnormal tissue that is pinching the nerve. And by removing that, you're cleaning up the nerve, and hopefully the patient will have some relief of their symptoms. But some patients are just predisposed to building up a lot of scar tissue where they had the surgery at the surgical location. So after the surgery, they may develop recurrent, back problems. They may develop recurrent nerve problems, and you get an MRI and you see that there's a significant amount of scar that has built up. So that's also, unfortunately, a relatively common cause of failed back surgery syndrome. Another reason for failed back surgery is instability, meaning a patient who had a laminectomy surgery done where the lamina was removed, but unfortunately, just like I talked about earlier, they developed an instability. For example, if you have a L4, L5 laminectomy, the L4 and L5 bones slip because you remove too much of the joint afterwards. So instability is also very common, and this is also very common amongst people who smoke. Smoking also causes other problems, just like we talked about a few seconds earlier, which is that it stops the bone from healing. So if you have a spinal fusion, it will just not let the bones heal. And I made a video about this, and this is a very commonly known problem. And patients who smoke after surgery will develop non-union or non-healing of the bone. But actually, sometimes patients who don't smoke can also develop the non-healing of the bone, and they may also need another surgery. Fortunately, for patients who have a non-union or non-healing, who are non-smokers, generally their condition can be managed very successfully at the second surgery by taking some bone from their hip. It's called the iliac crest bone graft, and that can be very, very successful. Finally, there are some situations where after the surgery, the nerve itself becomes damaged on the inside. This is called arachnoiditis. So when you're doing a laminectomy, when you're unpinching the nerve, you are mobilizing the nerve, you're removing all the degenerated tissue around it to clean it up. But sometimes, for unclear reasons, some percentage of patients will develop an abnormality of the nerve on the inside. It's not like you injured the nerve, it's just that the nerve itself begins to degenerate. So this can become a difficult problem, and arachnoiditis is one of those things that, unfortunately, once it develops, there's really not a whole lot you can do about it. So some complications after surgery are predictable, and some complications after surgery are unpredictable. And together, these can cause failed back surgery syndrome. The final category of failed back surgery syndrome are those patients where the surgeon cannot really figure out why the patient did not get better. And I can tell you from experience that as a surgeon, this is very frustrating. It's very depressing because, here's a patient and you have tried your very best to get them better. And unfortunately, for unclear reasons, they did not. So, for example, there are some patients who have a let's say, laminectomy with or without a fusion. And after the surgery, they either did not get better by a whole lot or they actually got worse. This happens, but very rarely, thankfully. When that happens as a surgeon, you get a new MRI, you get a CAT scan, you get x-rays, you get an EMG, nerve conduction study. But unfortunately, there's really no clear answer why the patient did not get better. So, you know, you as a surgeon think about your patient and you just feel terrible because, we pride ourselves on our goal and our mission to get patients better. Now, if you're a patient who has developed the failed back surgery syndrome and you've had a lot of workup done, my suggestion to those patients, and this is what I tell my patients rarely when this happens, is I send them for a second opinion to another surgeon, somebody who's very experienced. And sometimes, you can, as a surgeon, you may not have thought of a particular cause of failed back surgery. So thankfully, as a surgeon, if you are diligent, you can most of the time figure out why the patient did not get better. But on occasion, you do the correct surgery for the right reasons on the right patient without any complications. But fast forward into the future, the patient does not get better. And this is a very, very frustrating situation for the patient and the surgeon. Being a surgeon is a great responsibility. And I know that myself and the surgeons that I know, we always want to do the very best for our patients. And on those rare occasions when we don't meet our own expectations or our patient's expectations, this is very, very difficult. And as a surgeon, you have to be honest with yourself. You have to be honest with your patients. And whenever I talk to my patients who are about to have surgery, I always tell them that I will do my very best, but I cannot guarantee that you're going to get better. And if you as a patient are dealing with a spine problem and you have a conversation with your surgeon before surgery and you get the impression that the surgeon has a clear handle on what the problem is, has a good plan, and you're a good candidate for the surgery, then I think surgery would be a reasonable answer for you. But if you get the impression that really there's no concrete plan, or if surgery is not really recommended for you, then I think probably you should not push for having a surgery. Maybe get a second opinion, but if one or two surgeons have told you the surgery is probably not a good idea for you for reasons A, B, C, D, then I think you're probably better off not having the surgery. So I hope you found this video helpful. If you guys have any questions, please feel free to share in the comments below. I would appreciate it if you subscribe to my channel, give it a thumbs up. Thank you for watching and see you next time.